going to see the muscles of the larynx. There are extrinsic muscles and intrinsic muscles. So extrinsic muscles, basically, as the name indicates, extrinsic. They are attaching to the surrounding structure, and they are paired muscles. Basically, they are elevating larynx or depressing larynx. So palatopharyngeus, salpingopharyngeus, and stylopharyngeus and thyroid, they are attaching above larynx, so they are elevating, and depressing is because sternum is below thyroid, so sternothyroid is basically depressing the larynx. So these are the muscles. You can see this is the palatopharyngeus, salpingopharyngeus, and stylopharyngeus elevating, and this sternothyroid and sternothyroid muscle is depressing, and this is one of the muscle, thyroid muscle, which is also part of extrinsic muscle. So not much of work, only names are important here. The most important are the intrinsic muscles. Intrinsic muscles have three basic functions. Either they are opening the laryngeal inlet, either they are closing the laryngeal inlet, either they are adducting to produce phonation, either they are abducting, or the tension of vocal cord is being increased or decreased by these intrinsic muscles. So few of intrinsic muscles can be seen here. So you can see in this picture there are few muscles. These are this muscle is basically oblique arytenoid muscle, and this oblique arytenoid muscle continues as airy epiglottic muscle, which you have seen in airy epiglottic folds. And this is transverse arytenoid, which is the only unpaired muscle here. This is the posterior cricoarytenoid muscle here. Now you can see the vocalis from vocal process to thyroid. This is lateral cricoarytenoid. This is the posterior cricoarytenoid, seen in lateral aspect. Now what you have to learn is basically these muscles are going to do three functions. One is either they are going to increase or decrease the tension of the vocal cord, here they are going to abduct or adduct the vocal cords, and they are going either open or close the laryngeal inlet. Now you see the most important thing is here the cricothyroid. It is also known as the tuning fork of the larynx. It tenses the vocal cord. Okay, the vocalis muscle is also increasing the tension in vocal cord. The thyroarytenoid is basically relaxing the vocal cord. So for tension is basically changing the pitch here. Now a muscle that are abductors or adductors of the vocal cord. So only abductor is posterior cricoarytenoid, and adductors you will see the lateral cricoarytenoid and the transverse arytenoid. These are adductors. So this is very important. Posterior cricoarytenoid is very important because it is life-saving. It is the safety muscle. And similarly here this is the tuning fork. Now the muscles which are opening or closing, like they are pulling back the epiglottis, they are closing, then it is going back. The epiglottis going in its position is opening of the laryngeal. So these muscles which like basically oblique arytenoid and airy epiglotticus, they are going to close the larynx, and this thyroepiglotticus is going to open. So here it is opening, yes, and both these two are closing the laryngeal inlet. So you can see this muscle is thyroepiglotticus, which is opening the larynx, and oblique arytenoid. So these are the oblique arytenoid and the airy epiglotticus, they will be pulling the epiglottis back, thus closing this cavity. Now here you see the transverse arytenoid is adducting, the posterior cricoarytenoid is abducting. So I'm not going much detail, you should know the names. So how the phonation is produced, as I have shown in this picture. So air passes through this like how this air passes, like from here, from this lung, the air will be passing and the phonation will be produced. So what are the steps, how like this air passes? So basically during expiratory phase, during exhalation, small puffs are air passing, there is forced opening of adducted vocal cords. So you know that adduction is required for phonation, abduction for respiration. So vibration of vocal cord takes place because the space is narrow, air has to pass, the vocal cords will vibrate and the sound will be produced. Now is the sound sufficient to be heard? it will be amplified by the mouth, pharynx, esophagus, nose, and sound becomes a speech with modulations of lips, tongue, palate, pharynx, teeth, and articulators. So vowels are basically produced because of vibrations of vocal cord, lots of V in it. So consonants produced by tongue. So most important part, the sensory supply above vocal cord, and the sensory supply above vocal cord is by internal laryngeal nerve, below vocal cord is by recurrent laryngeal nerve. Now the most important part is the motor supply of larynx comes by the recurrent laryngeal nerve. The recurrent laryngeal nerve is the main motor nerve, only nerve which is supplying cricothyroid. The cricothyroid is being supplied by external laryngeal nerve. So you can memorize this line. All the intrinsic muscles of larynx are supplied by recurrent laryngeal nerve except externally placed cricothyroid by external laryngeal nerve. Now sensory, if you see above vocal fold internal and below vocal fold recurrent laryngeal nerve, we have seen if internal laryngeal nerve is damaged, so in supraglottic region there will be loss of cuff reflex, and if external laryngeal nerve is being damaged, so it means like the vocal cord cannot be tensed, and so there will be weakness of phonation due to loss of tightening effect of cricothyroid muscle on the vocal cord. Now if recurrent laryngeal is unilaterally damaged, so what will happen? The vocal cord on the affected side lies in paramedian position. Paramedian position between abduction and adduction, and also do not vibrate. But usually the other cord is able to compensate the phonation. So phonation is not much affected. Now if bilateral recurrent laryngeal nerve is damaged, both vocal cords are lying in paramedian position, so there is loss of phonation and also there is difficulty breathing. Okay, there is difficulty in breathing. Now if we see there is both a recurrent laryngeal nerve and external laryngeal nerve have been damaged, there is cadaveric position of the vocal cord. Now you see these are few positions, the median position, the adducted one. The paramedian is basically between abduction, this is the abduction and this is adduction, so the paramedian position. Here the cadaveric position is basically now posterior cricoarytenoid is also going. So posterior cricoarytenoid, it was abducting, so there will be no abduction, proper abduction, so it will be between paramedian and slight abduction. So this is known as cadaveric position, and these are like slight abduction and full abduction. So I think with this we end with the muscles and muscles we have seen, and now some clinical anatomy and foreign body cuff. Yeah, internal laryngeal nerve, cuff reflex will be gone. If external laryngeal nerve is damaged, weak phonation due to cricothyroid not gets tightened, and we have talked about this. This is an old presentation, that's why all these things are shown here. Now this is a very simple diagram from Datta. You can copy it, you can go with it. And so in which condition phonation will take place, not placed, in which condition the phonation will take place, not in this position, and adducted vocal cord will produce phonation, not in any other position. So thanks for watching.